Good afternoon or good evening, Miss Mia Moore. This is my presentation today. My topic is electronic medical records. Um, First of all, we are going to talk about the importance of EMR. Is to better healthcare in 2021 by improving all aspects of patient care, including safety, e- effectiveness, patient centeredness, communication, education, timeliness, efficiency, and equity. So, um, with that being said, all of those things are very important and electronic medical records. Then we move on to the relation to topic. The relation to topic, this topic refers to the different levels of electronic health record adoption in the United States. Hospitals found that very few have a comprehensive electronic system for recording clinical information and that only a small minority have even a basic system. Technology advancement. Um, we'll move on to technology advancement. I guess stating on how it has improved over the years. Electronic medical records would enable safer, more reliable prescribing, helping promote legible, complete documentation and accurate, streamline coding and billing, enhancing privacy and security of patient data, helping providers improve productivity and work-life balance. So that is also very important, especially patient documentation so far as prescribing medications, also medical billing as well. You work, you want to get paid for it, so we definitely have to make sure that that is correct as well. Um, the EMR consists of health information such as administrative and billing data, patient demographics, patient notes, vital signs, medical histories, diagnosis, medications, and immunization dates. Um, all of those, as you know, when you go to the physician's office, all of that information is asked of you. If not, you have to document it on a piece of paper so that it can be entered into electronic medical records. Um, Electronic medical records. An electronic medical records health record is the systemized collection of patient and population electronically shared health information in a digital format. Um, these records can be shared across different healthcare settings. And with that being said, when you go from one doctor's office, you can get the information sent to another doctor's office through electronic medical records instead of it having to be faxed um, or either faxed or you having to come pick it up and take it yourself. Electronic medical records are digital versions of the paper charts in a clinician's office, clinics, and hospitals. EMRs contain notes and information collected by and for the clinicians in the office, clinic, or hospital and are mostly used by providers for diagnosis and treatments. So, also is used, I know I see it used on a daily basis with diagnosis or even creating new diagnosis or helping to improve the patient's care and treatments whenever they're being diagnosed with something new or something old. Maybe it's something that you've had previously that crossed over from one doctor's office to another. So that is something that is very important. So with that summary being said, regarding the electronic medical records portion of it, providers better manage care for patients and provide better health care by providing accurate, up-to-date, and completing information about patients at their point of care, enabling access to the patient's records of more coordinated, efficient care. So now what we're going to talk about is implementing patient access to electronic health records under HIPAA. Lessons learned. Read an article. It was the Health Insurance Probability and Your Family Accountability Act, HIPAA, which is HIPAA. Emphasized the needs for patients to have a greater control over the health information. Implementing the summary. In developing the patient gateway system, members of the Health Information Management Department were consulted to assess current policies and procedures and any changes that were needed to major areas. Electronic communication and release of records were reviewed to provide EHR access while maintaining security and privacy. Patient gateway employs policies and technical procedures that can be categorized in the following domains: authenticating and authorizing patient use, authenticating and authorizing staff use, and secure messaging. So we all know how important health information is. That's why HIPAA is put in place, because you use HIPAA to make sure that you protect the patient and all of their vital information, because you don't want any of that information getting out. You just don't. That's a no-no. So HIPAA was put in place to protect the patient health information, so far as anything pertaining that they put down, unless they did a medical release for a specific person. HIPAA and protecting health information in the 21st century. Improving public understanding of the practice may lead to the conclusion that such deals are in the interest of consumers, and only abusive practices need to be regulated. Shaping health information privacy protections in the 21st century requires savvy lawmaking as well as informed digital citizens. So again, we're talking about HIPAA and making sure that all of the regulations are followed. And I'm pretty sure that some offices or some big hospitals, they have staff in place for that, make sure that all of those laws are abided by. And we're going to talk about the summary of HIPAA, which will further explain. HIPAA's privacy rules generally requires written patient authorization for disclosures of identifiable health information by covering entities unless a specific exception applies, such as treatment or operations. Researchers may obtain protected health information without patient authorization if a privacy board or institutional review board certifies that the obtaining authorization is impracticable and the research poses minimal risk. The investigators can obtain a limited data set that excludes direct identifiers. Examples: names, medical record numbers, without patient authorization, if they agree to certain security and confidentiality measures. So that's what we have to say regarding HIPAA. Then we'll move on to the patient access to electronic health records, differences across 10 countries. Many countries have policies guaranteeing patients accessible electronic health records. That's good in a way, because even though you're in a different country, your medical records can follow you, which is a great thing, especially if you're in a different country and then you have to have treatment right then. That would be a great way. Although all 10 nations included in this study mandate some type of patient access to medical records, in general terms, none mandates continuous patient access to the complete EMR data. So with that being said, summary of patient access. The 10 studies countries differ regarding access procedures, age restrictions, and other factors. So I'm pretty sure that different countries have different protocols so far as age-wise, and the transfer of records. So I guess you would have to make sure that you go by their guidelines and their standards to make sure that you be able to cross over medical records to where you're going to next. The current international status implies fragmented and unequal patient access opportunities. Policy action is needed in areas of inoperable self-assessed rights and data visibility. Individuals encounter very different access rights to their medical data depending on where they live. Countries may be able to develop improved policies by examining how other nations have solved common problems. Harmonizing policies is also an initial step likely to be needed. Better cross-nation could be possible. So basically, yes, different countries can implement different healthcare policies regarding on how they handle certain situations that they've come across to better assist their company. And then we have a New England Journal of Medicine. Basically, it talks about policymakers face substantial obstacles to achievement of healthcare performance goals that depends on health information technology. Policy strategies focused on financial support, interoperability, and training of technical support staff may be necessary to spur adoptions of electronic medical record systems in United States hospitals. The very low levels of adoption of electronic health records in the United States suggest that policymakers face substantial obstacles to the achievement of healthcare performance goals that depend on health information technology. A policy strategy focused on financial support and operability. And again, it just states that it does it's necessary basically to spur adoptions of electronic medical records in the United States systems. So and it states that over 2/3 of individuals report their healthcare provider has a EMR across all individual nationwide, regardless of whether the provider has a EMR or not. Over 1 in 10 individuals, 12%, request their health care provider electronically send their medical records to another healthcare provider. So it's becoming very common. It's very common now with it being 2021. It has really improved, and it is really beneficial. We hypothesized the relation of the EMR and hospitals. We hypothesized that large hospitals will have a higher prevalence of adoption of electronic health care records than smaller hospitals. We found no relationship between ownership status and level of adoption of electronic health records. The prevalence of electronic record systems in public hospitals was similar to that in the private institutions. So I'm pretty sure that some of the formatting is the same as the hospital to clinics, but I'm pretty sure the hospitals is more in detail because they see a higher capacity of patients than the usual clinics do. So I'm pretty sure that theirs is pretty much a little more in detail. The best electronic health records software of 2021 is Careo Clinical, CareCloud, Charts, iPatient Care EHR, ADSC EHR, and Advanced Med EHR. So those are some of the softwares that are most popular and more prominent in the healthcare field now. So this would conclude my presentation of electronic medical records. Thank you for your time and have a blessed night.